Okay, so assessing the neck in multiple positions, it becomes very obvious that some positions are better than others. So I'll say it out loud because I'm the only one with a microphone. Prone and lateral just don't work. The problem with testing anything in lateral is that you can't get the pair. You can't get the opposite side to figure out what the heck is going on. There are some things where you can understand appropriately what the heck is going on with that one thing, but you don't know if it's really the bad one because you can't check the other thing. So seated and supine for the neck allow the most freedom of movement without the table being in the way, because when the person's in prone, really the only way to test the neck that's meaningful is active rotation. Anything other than that is not worth your time. And even with that active rotation, they're going to come off axis because it's just what they have to do. And they're going to get all the way over. You're just going to see the winces and the difficulty. So it's more of a visual qualitative sense for asymmetry in the neck in prone. And then as far as lateral is concerned, you don't know what's going on because you can't really get the neck to side bend. You can lift the whole neck, so it's more like a windshield wiper than it is the letter C. So it's a problem, okay? Seated, obviously active testing is no problem. Passive testing, you have no choice but to switch hands, okay? I'm going to generally suggest against, although you want to know how to test all ranges of motion in all planes, I'm going to generally suggest against testing flexion or extension. Flexion, you can't breathe at some point. Everybody's going to get their chin to their chest. You are not going to find that problem, especially just because of how the anatomy is built. You're not really going to see it. Extension, there's danger with extension for multiple reasons. Some people might pass out. If you extend, side bend to one side and rotate, that's an orthopedic test for the vertebral artery, and the positive sign is blindness in the opposite eye. Okay? So the blindness in the opposite eye, is that a sign or a symptom? No. It's a symptom because only the patient can tell. Okay? It doesn't, I can't see, right? So it's actually a funky test. Vertebral occlusion, yeah, like you might be able to see the fluttering in the eyes, but you also might not. So the sign would be like, right? Or they maybe start to get messed up, but you generally don't want to use extension. So side bending and rotation are really your tests for the cervical column. And the rationale there is there's usually a problem on a side, right? So if you use the osteopathic approach, movement on one plane affects movement on all others, therefore restriction in one plane. If I move in one plane, I should see the restriction in the others. It's like, no. If I move in flexion or extension, maybe I'll see it deviate one way because the person can't do it. Or maybe that's the shape of their bones and their facets. I don't really know. But if I test rotation or I test side bending, I know what's going on. So again, circumduction hides problems. Pure planar testing shows problems. Okay? These are general things to keep in mind. So as far as in seated, the person has to keep themselves up, so you don't expect them to be as relaxed. You also have a higher requirement for maintaining control of the person, so you need to make contact. You need to be careful how you make contact with them to make sure it's not too creepy because you're behind them and they can't see you, right? Or you could be in front of them and then they're in your chest, right? So there's challenges with all of it. There's always trade-offs. But what I'm going to do is get close, make body contact, right? And to the degree that she's able to relax, she's able to relax. To the degree that she's not, I'm not going to worry about it too much. So I'm going to have a general sense here. Okay, I can side bend either towards this hand, right? But what I don't get in this is the sense of tension on the side that I'm lengthening, right? So I may want to do this. But then what I don't get is the feeling over here. So there's a challenge no matter what I do. Now, if I get real close to the neck and I bring my thumb around, so now I have kind of this weird yoke. So I have sensation crossing my hand in some way. I may be able to get the sense that I'm looking for. And would you agree this is about where it's restricted and it kind of feels like it's worse here? Mm-hmm. Okay. So here, if I'm here, I can't tell that at all. If I'm here and I have a lot of contact with the neck, broadly speaking, I can sort of get it. And it's there, right? Mm-hmm. Okay. Now I switch, right? So it's this. Now it doesn't have to be that, but it gives me more information. Now you see how I had to, as I'm going, I can't go anymore. I have to sneak my elbow out. That's the details. Now this way, this is about where the restriction is. You agree? But it's more here. So interestingly, in side bending, it's the same thing on both sides. Now, as far as rotation is concerned, rotate, and then it's about there, right? Yeah. Okay. Now, if I was like this, just keeps going. I don't know because I don't have the sense of it, right? But there. Okay. And now you may be able to visually see that, or you may not. But like, just look here-ish, as with respect to my fingers. You see it grab? Okay. And that doesn't really grab, right? You agree? That feels great. Okay. Now, each test is a unique test. I may not actually find the exact same things in supine, but we'll check it out. So essentially, there's 2 problems on the right side. And then, so with side bending, either direction, the problem seems to be on the right side. With rotation, the problem seems to be rotation to the left. Okay, so I say that out loud, and maybe I'll remember it, and maybe I won't. I don't know. We'll have you lay on your back. I'm going to need that. I need that.
Sorry. I'm not.
So, also, if you back up just a little bit, when people lay down like this with their knees bent, it may mean something, it may not. People who lay in supine and tend to just automatically bend their knees, you begin with the assumption that if they're in that position for a long period of time, that they have low back pain. You begin with that assumption. You don't know that you're correct, but you might be. Do you tend to have low back pain if you lay in supine for a long time?
Immediately.
So there you go. Right? So they just protect themselves anyways. People who don't know, they don't protect themselves, and you set them up, and then, and they'll often move better, but they feel like crap. Right? So she has glasses on. It's not the end of the world. No. It's not the end of the world. I promise, because I'm not going to squish your glasses. So now, as I go down, I want, as my hands go down the neck, I want as much contact as I can. My hands are a certain size. Necks are bigger or smaller. They're all kinds of sizes. But I want as much contact as I can have. So I need to contact the head to control it. But you see how my hands come all the way down the neck and up the sides too? Okay? Now we rotate this way. It's like you'll rotate farther, but this is about where you start to feel tension come into this side.
Yeah.
Right? So she'll rotate farther. Right? You see the SDM kick up. That may or may not mean anything, but it's about here. So, sorry, that was way too fast. There. It's about there. She'll go farther, but that's where we find it, right? Now, I also want to make sure that I keep her on axis. My hand is stuck on her hair clip, but that's okay. It's okay. It's really not a problem. But see, there's really no tension in this. You don't feel much. So that's the same as in seated, right? Now, as far as the side bending is concerned, I can make the letter C, right? So this is okay, but it's like here-ish again. Like you'll go farther, but you don't like it, right? Okay, it's about there. And the answer is no. Okay? Like, we're not getting this. Okay? So I'm making the letter C. So you can say that this is side bending the cervical vertebrae, or the cervical vertebrae, one over the other, like the letter C. And then you can also do this. Windshield wiper. Right? So you see how her shoulder starts to move? So this is more like, if you wanted to break stuff out, this would be more trap and levator scapula. Right? And there's challenges in both directions on that. Okay, so we have the letter C, side bending. She's in relative flexion. Like, big old no, this is not working. So we found up just about the same things. You can sit on up, it's okay. We found just about the same things in seated and in supine. But it's because we're creating the same movement, right? The requirement for control is much higher in seated because she has to control her neck. Obviously, like I said, lateral and prone are not worth it, but you experience that by trying. Some of you came up with some really good solutions. In lateral, you get rid of the pillow, right? And then you can bring them up and down, but it's hard work. It works better when you're at the head of the table if you have to do it. And what you would want to do, actually, lay on your side facing them if you're okay with that. Basically, you can take the pillow out, right? So, it's okay. No, you're okay. I promise you're okay.
That's an over my arm.
Wherever, Ricky Bobby. Just keep your hands by your side, right? So you see this? Like she doesn't like any of this, right? I'm moving smooth. I've got good control. My elbows are tight, right? But I can't, you see how my hand's in the neck? Like I can't side bend further than this. But when I go up this way, I absolutely tell what's going on, and now she's controlling it, right? So I would have never thought to get the pillow out of the way because I'm a big dummy and I learned a particular way, and I didn't think outside of that until I saw somebody else do it. There you are. Good job. Right, sit on up because you don't need to be there forever. And then rotation, you can tell, would be tough. If you're in front of the person in lateral, their head is in the front of you, like right here. Kind of creepy. If you're behind them, it's hard. It's actually really hard to control, right? So it's a problem no matter what you do. That said, as long as the movements are the same, you ideally should find the same stuff. But each test has its own parameters. Therefore, it will sometimes mess with you because it will show one thing and not the other. At least in that case, we've had the same findings, which is very nice, but sometimes you'll have different findings. It's one of the reasons you want to be careful with redundancy in testing. Test a thing one way, make a choice, and work with it. Don't test it in every position because it will confuse you. It's too much to remember, and you're going to screw up because the tests are different. All right, fair enough? Okay, we're good.